I'm putting you on. We are now recording, everybody. We're going to post this on the LOM website for those who couldn't be here with us. But Brad, take it away.
Perfect. Great. No, thanks, Don. I love the energy in the room. This is great. And I feel like I want to go to camp myself this summer. I think right now we've had a lot of conversations with, camps and associations and directors. And I think it's, on the one hand, it's so exciting that we're going camping this year, and that we know a lot more than we did last year. But at the same time, there's just a whole lot of conflicting information and challenges, and frankly, staring at additional expenses to look at. So my hope here is to just give you a little bit of a vantage point into where things currently stand, a little bit about CIC Health and what we've been up to, and then talk through some of the things that a camp director could put into place to be able to continue to have a safe return to camping this year. So with that, just a little bit about kind of who we are, where we fit in. We started last year, and based out of Cambridge, Massachusetts, and really saw a need where things were not being done cohesively in the country to be able to kind of get access to, at high volumes and low cost, COVID testing, and got together various folks, including the Broad Institute of Harvard and MIT, a gentleman named Atul Gawande, who is very well known New Yorker writer on Biden's COVID transition team, to kind of create this organization to really help jumpstart that, and have made a fair amount of progress, and especially, as Don mentioned, with the youth community. We are, now, I think, we're certainly, if not the largest, we're one of the largest organizers for testing, but really a big part of that has been around the youth community. Here within Massachusetts, we're working currently in over 600 public schools, and also are working in several private schools as well. What kind of happened here coming out of last summer, when the cost of testing was still high, we had a very low cost, but still it was $50 to $60 per test. You saw a lot of the well-funded private schools and colleges that were able to do that, but it was very challenging for a public school to do. And so we really worked together with the labs and the states to come up with something which has now allowed us to be inside of public schools. And we think it's a model that could work quite well for camps as well. So, I'll talk, a little bit later, but, the big secret sauce here is the ability to get access to lab PCR testing through doing pooling, which drives down the cost. Instead of being in the $50, $60 range, it gets down to about $6. And so that kind of changes the whole calculation about what is possible for running a camp. And so we're happy about this, and there's going to be, I think, a lot more of this across the country. There's funds that are out there that are certainly allocated for K-8 education, certainly is going to be out there when it comes to summer school, and there's some question marks around camps, and I'll talk about that in a moment. And we're also very big in the vaccination business at this point. We run the biggest vaccination sites here in Massachusetts, including at the Gillette Stadium where the New England Patriots play. So testing continues to be critical. I think, people are aware of this. The K through 8 the youth population, will not be vaccinated for quite a while. But even as we're in this in-between period of not everyone being vaccinated, with these new variants that are out there, there's really, from many different experts, this thought that we really do need to stay on top of this, and that that we certainly need to be using many other mitigation measures, but testing is a very important piece of this. And the trick here is to figure out how to do that in a thoughtful and cost-effective way. So a little bit on this, and certainly, as we go along, I don't know, I think maybe people can put in, in the chat any questions, and if it makes sense to answer it live, we can do that, or we can collect it at the end as well. So I imagine that many of you have seen guidance. If you've not already looked at the ACA field guide, I think that was published in January or so. The CDC also has some guidelines for camps. They keep on promising that it's going to be updated. I haven't seen that update yet, but there's some things that are very clear and that we can say. No matter who you talk to, whether it be the state level, whether it be the federal level, the importance to get the pre-arrival and the integration into camp done correctly is paramount. That is incredibly important to make sure that people are arriving in camps. And I think a lot of this is also based upon, the research that was done from last year, where you had the notable cases, including the case in Georgia, where you had, 2/3 or more of the camp that came down with COVID. And, that was a time where we didn't know very much. But I think right there, you had many asymptomatic people that were showing up at camp, and the camp never had a chance to catch up on it. So I think the pre-arrival certainly is quite important. Clearly, we need to continue to take everything that we've all learned, as well as the various, directives around other safety measures. So I think we all have learned a lot about masking and the value of masking, in an indoor environment in particular. But certainly, if you're going to be in close quarters with one another, that continues to be very important. And certainly, all of your environments are different. But I would expect that everyone would be following that, as well as the other safety measures that are out there. And there is some, there have been some studies. There was one done in Maine, where they had a camp that was doing regular surveillance testing, which is similar to what's being done in the schools and the colleges, which is a regular cadence of testing in a weekly basis. Some cases they're doing twice per week. That the camps that were able to do that had the best outcomes in 2020. And so we're able to maybe not eliminate all cases, but we're able to eliminate any sort of spread. But I imagine at the same time that there are, in your minds, there's lots of questions, some of which I have points of view on, answers on, some of which, we're still waiting for some more information on it. The cost, first off, could be, a significant percentage of operating costs. I appreciate that, and I'll show you a slide showing, what offerings we have, including individual tests, which are great. But you're talking about a price point that is, it's over $50 per test. So that becomes a very significant portion of your operating costs. Funding is in everybody's minds. There is, and I've read through, what coming out of the American Rescue Plan. So there is a lot of money for education. And if you read that, what it does say is that the states do have the ability to use that funding towards, summer education programs, as well as towards, and it's very vague, but towards summer programs that place an importance on access. I forget the exact words. So depending upon the governor, you have the ability to be very narrow there and sort of just keep it just towards the schools and the school programs, or you'd also have the ability to make it wide. So we do know, for instance, that in Texas, that Governor Abbott has made the Abbott BinaxNOW tests available to all camps. We do know in the state of New Hampshire that Governor Sununu has made a statement saying that he's going to cover the cost of testing. But I've talked to camps up there, and there hasn't yet, and I'm not sure whether, Don, you've heard anything, but there hasn't yet been any further clarity of what that looks like. So there might be some funding that might coming out of the federal level. I think the states are having a challenge into how do they actually make that happen, given that it's a very short 8-week period. So we're certainly trying to be in those conversations, with our experience that we've had, with the school programs. Certainly we're seeing some things with, locally, we're seeing some foundations and such, that have embraced this, and certainly would welcome, and if you're not already having those conversations, you might be surprised in terms of willingness. Insurance is a question. So this is a very vague one. So what I think what is clear, and this comes out of the Department of Medicare and Medicaid, is that they evolved the guidance over the course of last year. And so it's now the case that anybody can get a COVID test one time without necessarily a doctor referral. So the example that they would give is if you were going to visit a relative, you could go and get a COVID test and have that be covered by insurance. Our view is that that would also cover any sort of pre-arrival test that your campers would have. I think that's, to me, that's very clear. I don't think there's much of a debate on that. When it comes to once you are at a camp, there's very clear language that says that the payers, that Medicare, Medicaid, and other insurance companies are not expected to pay for ongoing surveillance tests. There are some providers out there providing services that we do that have said, go ahead and collect insurance IDs of all your campers' families, and we'll submit it. And if they don't pay it, then we'll charge you. We're not doing that. We don't have the ability to bill insurance. And I think as people have looked at it, most are believing that the insurance companies will not pay for it. But I appreciate that is a question mark. So that's what we can say about that. And then complexity is another thing in your mind. Is certainly you have enough things to worry about in running a safe and fun camp. To have this other layer on top of it is something that, very mindful. You want to have something that doesn't distract you from your overall core mission. So we can always come back to this with questions as we go on, but just wanted to kind of start with this as context. And by the way, I failed to mention my colleague Kenny Lackey is on here as well. Kenny who's worked with lots of organizations, and can certainly, Kenny, feel free to chime in if there's a point that I've missed or should be emphasized. So, why test? I think you've probably seen versions of this. I won't go into it too much. I mentioned before, the CDC guidance that testing remains important. There's this notion of a Swiss cheese model. If you rely upon any one layer, it's not good enough. So certainly, I would expect that you're doing basic things around symptom checking, around masking, around social distancing, and COVID testing is just one additional piece of it to, and these things together collectively create, a safe environment. And, using a woods, metaphor for camps, we're not out of the woods yet. This journey is, continues to kind of move. I think in the beginning, when we didn't have any testing, it was purely the risk prevention measures that we had. Testing, has become more prevalent and economical. So, frequent testing is a piece. And now we're in the vaccination stages, and it's great to see that, that the vaccination numbers have really risen. But we also know that, kids will not be arriving at camp vaccinated. And so, and I'm not sure where your staff will be as well, but there certainly is going to be a mixed environment. And also, frankly, the data is not, it's not completely clear in terms of the views around vaccinated individuals with other non-vaccinated people and the risk of spread. Everyone's very cautious in talking about that. So, the general guidance that we would have is that, if testing is cost effective enough, that we would encourage you to test the entire environment and not to have that in your mind about whether or not you're still at risk. But that's where we are right now. Okay, just to make sure everybody's grounded here, and there's a lot in this page, and I'll try to make it as simple as possible. There's two, generally, there's two different types of tests. There's one, which is, if you think about the picture of the COVID that we've all seen with kind of like the little blob with the little spikes at the end, the one tests, which are the antigen tests. These are the tests that are on the right side of the page here. These are the ones that are the fast tests. And what they're doing is they're looking at the spike proteins that are at the edge of the coronavirus. The other tests, which are today mostly done in the labs, there are some non-lab solutions, but they're just too expensive right now, are these molecular PCR tests. And here you're actually getting into the virus RNA. So the difference here, and this is a chart that comes out of Nature magazine. There's an article which I could find because it's quite an easy to read article to kind of explain this. This chart is talking, the line here is talking about the viral load. And so what happens is that when you first are infected, you start accumulating viral load, and it starts accelerating pretty quickly, and then it lingers for a while. A PCR test is able to detect at a lower amount of viral load. So in the example here, any dot here that is yellow represents a positive test. So what's happening is, you can see here in terms of number of days, you have a situation here where the same individual received a PCR test as well as an antigen test. And because the antigen tests require a higher viral load, it came back positive at a PCR test, but came back negative on an antigen test. In that situation, you could have yourself a challenge where a couple of days later, this individual is still in your population and could infect. So a lot of people will refer to the antigen tests as a contagious test. It's a test, so antigen tests, in the early days kind of got some, bad name about antigen tests because there's so many false negatives and positives. Generally the tests are pretty good. And generally the biggest issue with them is just simply that they require more viral load. So if you were doing an antigen test like every day kind of a thing, it could be a good way to run things. But if you're taking a one point in time, the concern there is that you might be missing something. And that's the simple thing. I'll talk later in terms of where we see antigen tests fitting in, because obviously the speed of it is something that's quite attractive. And certainly when you have somebody that is symptomatic, having the ability to do an antigen test right away is absolutely a great resource to have. So in terms of a camp testing program, this is not just kind of our view. This is kind of what's in the in the field guide, as well as other places. I think if you just kind of divide it into kind of three pieces, you have the arrival, the arrival and integration, and ongoing surveillance. Now, I understand from talking to Don that there's many of the camps here are kind of shorter duration, many 1 week camps, but also some that are 2 or 3 weeks. Certainly for any camp, regardless of your size, having a strategy around pre-arrival is quite important. We have the ability, and I'll share later, we have a pre-arrival solution through test kits that we are able to provide to you and provide to your campers, where they can do a kit at home. They just drop it off in UPS. They're not cheap, because you're dealing with shipping costs. But it's certainly possible, but they're very easy, and they can be done, done at home, and is certainly a solution. But our recommendation is that you have very clear guidance, towards your families about your expectations to have a test done, with the appropriate amount of time. So we would say certainly 72 hours, if not sooner. Now, states have different guidelines, but that would be, I think, the best. And that, most families should have the ability to get access to that through insurance or through a free state site. So certainly we can complement your efforts But that would be the most cost-effective thing, would be for them to get that on their own. When arriving, our view on the arrival is that, right on day one, it would make sense to have an on-site PCR test, either pooled or individual. Pooling we'll talk about what pooling looks like. So pooling has a lot of advantages and costs. Individual testing has some advantages as well, in terms of you immediately know who is positive. And then we would suggest that you would follow that up with an additional test on day 5 or 7, depending upon what the structure of your camp is. Antigen testing plays a supporting and complementary role. So an antigen test then becomes, if you're doing pooled testing, which I'll talk about a little bit later, when you need to figure out who in the pool is positive, an antigen test is a very good tool to use there. And I don't think I have a slide on it, but and I can provide this information afterwards. But if you have not already gone ahead and received a CLIA waiver for your camp, which allows you to use antigen tests, the Association of Camp Nurses has a very good overview on how to get that. I think it's $150 to get it. Once you have that, you're able to order and administer.
Who art in heaven,
Hallowed be.
That was a great interlude. And I think that just makes sense to have. You have that ability, and I could also give you some information on how to order those tests directly from Abbott, the Abbott Buy Next Now tests, which you can get, I think they're selling them for $5 each. So that's something that certainly you should have. So that becomes something you could use after the pool, but also you could use that for any of your symptomatic populations. If you don't have the CLIA waiver, you can also get these tests now over the counter through various sources. I think they're about $25 each. You can buy them over the counter. So then we would also suggest that you would do ongoing surveillance testing, if your camp is longer than a week, but certainly for your staff that's around, and that's using kind of frequent surveillance testing, again, using pooled PCR or individual PCR, depending upon your preference. So with that, all of the tests that regardless of whether it's an antigen test or a PCR test, any of the tests that we're talking about here, is the anterior nasal swab. It's the lower part of the nose. We use this slide with our schools to educate the parents and the students. It's as easy as picking your nose. I think I had mentioned to Don or possibly, but we actually, when we first did the school programs, at first, together with the state of Massachusetts, we said to the schools that any child 2nd grade or below needed to have an adult administer it for them. But then we actually did a study, and we actually compared the results in the lab, and actually the kids did better. So the kids are, a 6-year-old can do their nose better than an adult can do their nose. So it's all these tests are quite easy. It's you do it by yourself, one nostril at a time, and it's quite efficient. There's some other solutions out there that use saliva. I think in the beginning, those are kind of seen as being attractive because they were being compared to the swab that was kind of the brain tickler, so to speak, in the back of your head. But I think most people with experience, much prefer this anterior nasal swab, as opposed, once you're dealing with if you do the saliva, it just takes time. Some people can't get the saliva. It just adds another variable that's unnecessary. So then I talked about pooling, just so visualize what we're talking about, and I'll show in a second a quick video so you can see it in action. So in individual tests that you could do, you're talking about one human, one sample, one tube, and you're getting a single result. And that single result also includes the public health reporting. So the individual is tied to that sample. Whereas in a pooled test, it's more of a surveillance test. So there's no public health reporting on the pool. But what you would do is you would have 10 people, we have some pools that are bigger as well, into a single tube, get a result. If it's positive, you would then retest. And this is really a way to, dramatically reduce the cost. You would then retest with an antigen test or a PCR test if someone was positive. And that's what this is showing here, that you're dividing people into groups, you're collecting samples. If it's positive, then you go ahead and do a follow-up test. What we're seeing here with our experience with all the schools here, we're not seeing a lot of spread in the schools. In total, about 1%, just under 1% of the pools are coming back positive, just to give you a sense of things. I know it's going to be different in every state in terms of positivity rates, but some of the concerns about pooling is that you're going to be having a lot of campers that you're going to need to kind of pull out until you get to the bottom of who was positive. But we think that the incidence is going to be, relatively low as long as you're catching it early. So with that, just as a break here, but to kind of just help visualize this, the Elliott School is a public school in the city of Boston that is running a pooled testing program. And just to give you a sense of the structure and the flow of this and how the kids are involved, and we believe this translates quite well to the camp environment. So let's make sure that this. So let's get back here. So hopefully that makes it more clear. We don't have a camp video yet, because we're not going here. But I think there's different models that have worked in schools. In that video you saw a cart that was going around to classrooms. So that's kind of one approach that you could take. Or some others have done it kind of by homeroom. So I can imagine in a camp, if you have different sessions of where you're going to, art or archery, whatever it is, you can maybe have that be where you do the testing. The logical groupings, of course, would be, within a cabin, include the relative staff to that as well. The pools the pool offering is generally 10 to 1. So you would just have to be thoughtful in terms of who's going into those 10s, and maybe if you had a cabin of 12, maybe you would do 2 pools of 6. So these are the kinds of things you can kind of figure out if this was something you wanted to explore. So then, there's also, there are also individual PCR test options. I mentioned the at-home test kits. So, real easy. There's a box and it gives you all the instructions. You leave it at your door for UPS. You get the results in 24 hours, and that's certainly a good option. Although our belief is that most families should be able to get free testing through insurance or the state. So you could potentially, so some camps have talked about just having this as an option, and potentially if parents wanted to have that easy option, they don't need to leave the house. That could be something that you offer to them, but it's something that certainly we could put together for you if that was of interest. And then on-site testing, so we have the ability to do individual testing, which would then prevent the second test. But also we've worked with our labs so that if you were doing pooled testing and you needed to do a follow-up test, antigen would be one way. PCR, another PCR test would be probably a better way, although you'd have to wait for the result. Our cost for that second test, the PCR test, is less expensive than a regular PCR test. So I'll share the pricing later, but it's something that we have as a possibility. So just I'm sure I'm going to leave some time for some questions here. So just kind of wrapping up a bit in terms of kind of what our role is here and how these pieces fit together. So basically behind the scenes, you have various providers that we work with. So we have various processing laboratories, all of which we very closely talk to all the time and manage the capacity with them, because none of these things make any sense if you're not getting the results in under 24 hours. That's kind of from the beginning. I talked about our mission in the very beginning. It's all around a 24-hour turnaround, and we're seeing it actually much faster than that. So we have these processing laboratories. We have the clinician network that we use. So when it comes to the individual tests, it's kind of behind the scenes to you, but the clinician partners have the ability, they're the ones that are ordering the tests, but also on the back end, the ones that do the consult with somebody if they're positive, but also do the public health reporting. And then there's also software partners for all these solutions that kind of knit things together. All of this, of course, is HIPAA compliant, and in fact, with a pool solution, I didn't mention that, but one thing about the pool solution that you may have saw in the video is that none of the PHI, none of the protected health information actually even is entered into the system. It stays. So if you were doing pooled testing at your camp, you would keep that information at the camp, and it's very easy to basically just kind of scan in the barcode and associate, and so you know who's in each pool, and that information is not shared, which is something that gives comfort to you as well as your parents. We have national reach. Certainly we're founded here. The Broad Institute has gotten a lot of great news. They're doing 1 out of every 30 tests in the country. You can go to their website, and every day they have a dashboard showing how many tests they're doing. They're I think it's between 150 and 200,000 tests per day. Is that right? Yeah, I think that is right. So it's a very big number. But we also have several other labs, with these, with the stated states here, to give us all 50 state coverage. So that's something that certainly we can offer. I mean, the reality is that, everything, in all your cases, things are going to be shipped to a lab. So really the key thing is to have the ability to have FedEx or UPS shipment to the lab. And then from there we get the fast turnaround time. And then just thoughts, some early thoughts. I think one of the things we appreciate that there's a lot of probably commonalities around around the LOM camps, but there's also a lot of uniqueness as well. So I think certainly we'd be thrilled to to work with any of you where our services met your needs, and certainly having that collective understanding of the culture and challenges would be great. We'd be more than willing to help you facilitate best practice sharing. If there is some collaboration, shared templates, certainly we have standard things when it comes to consent forms, et cetera. But if there's anything that in terms of the way you're communicating to your families, et cetera, that made sense to kind of do on a common basis. Certainly we'd be willing to, participate in those discussions and to help facilitate that. When it comes to, for instance, the public schools that we work with, we have kind of shared webinars for parents of any of the public schools to join to hear more. And so that would be something as well that could be a possibility if that made sense. So I haven't, Don and you and I haven't talked about any of this, but I mean, certainly that would be, these are all things that would, if it made sense, would be willing to do, because we try to standardize things as much as possible to make things efficient and cost effective. But we realize that there's some things that also, are particular to you. So we've been pretty good at understanding the needs of our schools and other clients and being able to customize that. So then, just to give you, a sense in terms of the cost of things. So a pool is, approximately $6 per individual. The reason why it's approximately is that the way that we sell that is that a pool of 10 costs $58. So if you were filling up every pool exactly with 10 samples, that would be $5.80 per person. But it might not make sense for you to fill up every pool to 10. So that the cost would go up accordingly. There's a ongoing subscription fee that just covers our, costs of supporting you. We have, customer service, and you have an implementation associate that works directly with you. And there's, for any program that we do together, there'd be an upfront cost to, get things up and running. When it comes to the individual tests, depending upon the lab, those tests are running between $42 and $62. It's not listed on here, but the at-home tests for the pre-arrival are a bit more than that. I think they're more like between like 70 and 80. Is that right, Kenny? I think it's about that.
Yes, that's correct.
Yeah. Okay. And that's just because it's adding that additional cost of the shipping. Yes. So, and then, in terms of, this is something which none of these tests require that you have medical experts. All of them are things that you're able to do with your administration. We'd expect that you'd have obviously some medical expertise in your camp, but but all these things can be supervised by somebody who's been taught how to do it. So it doesn't, so that overhead of having a third-party medical expert is something that really, to us, is very important to avoid. That just adds unnecessary costs. So that's what I had to share. Yes, I put in, our website is here. If you take a picture of this with your phone, you can also go there as well, or you can, just good old-fashioned keyboard and go to Google. But I'll stop here and see if there's any. I didn't see the chat. Were there any questions in the chat?
We had a couple that I addressed, and for anyone who hasn't opened the chat yet, I just encourage you to go in there and you can click on the blue everyone icon and select my name. If you'd like to make sure we get back to you, just send me a private message with your full name and camp and email address if you would.
Why can't I get to the chat? Was it, I'm sorry, did you say there were questions in there, Kenny?
One was about turnaround time. We had another one on a CLIA waiver. I think that's it so far.
Okay, great. Yep. So turnaround time. So our average turnaround time, from we measure it from the moment that a collection is happening at your site to the moment that a return comes back. So we're seeing right now that's like about 26, I think. The last time I checked, so that's so the lab portion of that is running consistently, like somewhere between 13 to 16 hours is kind of where the lab's running right now, and we expect that all of our labs should continue to be operating at performance. To be honest, with schools and colleges have been the biggest demand for the labs. So in the summer, the capacity should be, we expect to be pretty good, and that's something that we stay very much on top of. Yeah, so the antigen, I don't see the question, but I will send. I'll send out the information on how to get access to the CLIA waiver. Which I think my understanding is every state is a bit different in their turnaround times. I've heard like California is being slow, but I'm not an expert at it. But I think certainly going ahead and having that in your back pocket, so you have the ability to get access to those tests, makes sense to us. I have not ordered an over-the-counter test directly yet, but I know if you Google it, you'll see there's various companies that are selling them. I don't think they're in the drugstores yet, but just last month, the FDA gave an update to the emergency use authorization to those antigen companies to allow those tests to be used over the counter. Yeah, so I see, Bob, I see your question about for a 5-night camp. So certainly pre-testing, certainly, if you have that option to do it for free, free is, somebody's paying for it. So either it's through a state program or through, another payer. We would still recommend that you had an arrival test. And, we try not to be the medical experts. You just try to bring kind of what we've seen elsewhere. If you're, even with that pre-arrival test, there's some risks there. And, as folks are, certainly, heard from folks saying that, certainly don't want to have you probably want to set some pretty clear expectations for the kids in the family about what they do before they arrive. So like youth sports, if it's, running outside playing soccer is great. If it's playing hockey or basketball inside, maybe not so great. If it's a tournament in any sport, I think most people would say, please not do that, because these are the kinds of events that, would have that kind of a risk. But, our view is that, at the cost of doing these pooled tests, that, we think that we would recommend that you complement the pre-arrival with an arrival test. But there's certainly many experts out there and conflicting opinions on it, but that's what we would suggest. Were there other questions that have not been formed yet, or are the ones that I missed?
Brad, it looks like we are not getting any additional questions, at least in the chat. And I'm wondering if anybody has anything that is pressing for you to ask a question about before we bring this forum to a conclusion. Anybody want to unmute and ask a question of Brad before we move on? And I'm wondering if there are any of you on this Zoom who have already made decisions about what you're going to do in regard to testing this summer that you'd be willing to share with the rest of us, just to give us an idea of what some camps have already decided to do or are strongly moving in a particular direction. Anybody want to share that?
Yeah, this is Bob at Luther Haven up in North Idaho.
Hey, Bob.
We're kind of anything goes as far as masking, vaccinations, testing. It's pretty much a free-for-all here societally. Yeah, so we've decided to do the testing. We haven't really nailed that down for sure, but requiring that all campers are tested prior to arrival. And again, the dynamic is if we test them when they come on Sunday and we don't get the test back for 24 hours, so Monday they're positive, they would normally be leaving on Friday, so we're not going to hold that kid all week. And so we call their parents, 4-hour drive, 6-hour drive, come get your kid. You know, it just, in our situation, it just doesn't make a lot of sense to, I think, unless I'm wrong, to test when they arrive, just because of the turnaround time. Most of our kids are there for that five nights, 6 days. But they're coming from, you know, from a whole bunch of different states. So that makes it really tough.
Yeah, no, I know it's, you know, and, you know, most of the pools will come back negative. I mean, it's just really hard to say, Bob, because it's you know, it's the case of, you know, in that environment, you know, what generally has been, that's why most of the schools here are using the antigen test for the reflex test, because hopefully they can then identify very quickly who is positive. And, you know, with the extra day, you know, you probably have developed enough viral load to pick it up. So in that situation, Sunday test, you know, if you get those out, you know, if you do that early enough in the day, you get it out, you'll have the results back by, you know, by midday Monday. Pull the 10 kids aside, do an antigen test, and know what you're dealing with. You know, as opposed to having the uncertainty of having an asymptomatic person in your population.
Yeah. We've also decided that our frontline staff, so if you're in a cabin, if you're a cabin counselor, you're exposed to that revolving door of kids every week. They're required to have be vaccinated.
Great. Yeah. Great.
Getting pushback there, of course, but that's what we're saying so far. Just because of the whole reckless endangerment of employees kind of situation that we're putting them in, kind of like meat packers, only in a different case scenario. But
can I ask a question about that sentence you just said about required? Because I'm hearing different things. Are we allowed to require it? I thought under emergency authorization, we were not allowed to make it required. And that's where I'm struggling with our staffing and what we can and can't do. Yeah,
you can legally, because we've run this by our legal team, and there can be different classes of employees. And so if you're putting them at danger by putting them in, again, with that revolving door of kids every week that they're in close contact with, that they're sleeping in the cabin group, or other situations, as an employee, you're not allowed to endanger staff. And so you can't expose them to any kind of a contaminant that's out there. Be that chemical, be that dust, be that whatever, environmental. And so this is considered the same thing. And so we've gone with the classes of employees that we are requiring to be vaccinated. Otherwise, we would employ them in another situation. So we're not precluding their employment, but we also cannot put them at danger, at physical danger. And COVID has been recognized as a physical danger that can cause serious health complications or death. And again, by law, you're not allowed to do that. So that's the route we've taken.
Cool. And do you know, is that an across the board thing, or is that a state by state thing?
Well, that would be OSHA. So you could look at the OSHA, Occupational Safety Health Administration. You could look at that and other pieces that are out there that we'll talk about that. You could go Google COVID employment OSHA, and a lot of that'll come up.
Awesome. Thank you.
Yeah.
Well, great. So
any other dilemmas that any of you are facing, similar to the one that Deb just shared, that you would like to get some collective wisdom from the rest of the group while we're all on here talking about COVID protocols and that type of thing.
This is Rod at Ingham Okoboji, and would really love to hear a little more about if several other camps are taking a similar approach with requiring vaccines, or how are you dealing with that risk? Here at Ingham Okoboji, currently we are encouraging our staff to get vaccines, but not requiring them.
Yeah, we at Luther Haven strongly encourage and then required for certain classes of employees, and then there's ways that we handle the vaccinated staff with the unvaccinated staff, and we used information from the Association of Camp Nursing and Camp Docs, and then again our legal team weighed into it. I just put up in the chat my email if you want a copy of our legal document. I'd be happy to send that to you for just some reference on that.
That's a great offer, Bob Baker. Thank you very much. I'm wondering if anybody has, in similar fashion, documents that you've worked up either for your summer camp staff or for protocols with summer camp for kids that you'd be willing to share. And while we're talking about that kind of resource sharing, don't forget that I think we've got a great platform now on the LOM resource sharing on Slack for doing the kind of resource sharing that you just mentioned, Bob Baker. Thank you. And while we're talking about mandatory vaccination possibility, let me ask you who are on this, and maybe you could just send me an email to tell me what you think about it. But we're really looking at November 8th to the 12th for the LOM annual gathering to be live in Bloomington, Minnesota. And I'm interested in hearing how you feel about requiring vaccination for all those who participate in the LOM national gathering. So maybe you could just send me an email to tell me what your opinion is on that. Okay, we're getting near the end of the hour. Brad and Kenny, thank you very, very much for sharing with us in this way. And who knows, maybe we'll see CIC represented as one of our business exhibitors at the LOM gathering, Bloomington, Minnesota, November 8th to the 12th. The information for our business members is on the LOM website. Let me know if you have any trouble getting to that. And everybody, keep your eyes and ears open, because soon we're going to be sending information to all of our camps about accessing the opportunity for 2 representatives from each camp to have their complete registration paid for at the double occupancy rate at the LOM conference, November 8th to the 12th. That's coming up. I know that all of you are really in the throes of making plans for summer camp or for whatever kind of intergenerational camp you might be doing this summer. And you are, I think we're all in each other's thoughts and prayers as we continue that work. And I'm going to close this with a bit of a benediction prayer and ask that you pray with me and saying, Lord, you have promised to be with us at all times, especially in times of great peril. We give you thanks for those who come to our assistance by sharing knowledge and wisdom that they have accumulated. We give you thanks today for Brad and for Kenny for taking the time and the energy to share what they have learned in regard to this particular part of the peril. We pray that you calm our bodies and minds with your peace which passes all understanding, and make us radiant with your joy so others may see you in what we say and do. We pray all of this through your Son, Jesus Christ, our Lord. Amen. Thanks very much, everybody, for being with us. Thank you, especially Brad and Kenny. And we look forward to being in contact with each other, in touch with each other, and supporting each other in the time moving forward. All right. Thank you, everybody. I'm going to bring this meeting to a conclusion. And I'm going to say it's going to end the meeting for all. Thanks.